Hello, my name is Renee Abdominis. I'm a physical therapist here at Complete Physical Therapy, and we're going to talk about our core today. So what I'd like you all to understand are about anatomy. So if you find your belly button and you go over to the side, about an inch or so with your fingers, and then you just lay those fingers down. Those are called the transverse abdominal muscles. They are our foundation. They connect our upper body to our lower body, and they're really important. I want you to think about those are our targeting muscles right now. We use these muscles for our stability. They're so important for our back and our achiness sometimes that we can experience in our low back. Very important after any type of abdominal surgeries or cesarean sections or even radiation therapy or things with chemotherapy that you've had to experience. Very important after having babies and getting our body back into shape there in a safe way. So what we're also going to do here, we're going to start with finding these muscles, belly button over, and then lay those fingers down. And what I want you to think about is pressing back. Or if someone was going to kind of punch you in the gut, what would you do? So if you were to get kind of hit in the stomach there, you would brace or engage those muscles. And as you engage those muscles, that motion is just back toward the spine. This is another way of finding these muscles would be lying down. So when we're lying down, that might be an easier way of kind of seeing. So if you were to lie down, and find your belly button again, over to the side, lay your fingers down. Now we go down into the surface of the table. You'll notice this is a pretty hard table. So if you were at home and you did this in your bed and your bed was very squishy, this might feel very different. So you may need to go either on a wall or a surface that's not so squishy to start. As you're here, you'll engage down into this surface. If you find yourself rocking your hips down and back, that is really not exactly the motion we're after. We're trying to just engage those lower muscles so that they're hard, solid down toward this surface. As you're doing that, I'll have you count or exhale. So we'll count to 5. 1, 2, 3, 4, 5, and then let off. When we're bracing, I want you to think about this as first to the party and last to leave. And by that I mean we're going to engage these muscles before we lift our groceries, before we lift our children, before we push the door open or lift the dog up, any of those activities. So we'll engage here, okay? Then we would lift, or then we would do push or pull. And when we're done with that objective, we'll set it down or set the child down. Then we can let off with that core. Very important. It will become more natural the more you practice. The next activity with this can be an engagement and then a slow march. So as you engage, you can slowly march either leg. You'll notice that I keep my feet close to my body. This gets tremendously harder the farther the feet are away. This is a slow activity, and the main purpose of this is to really be engaging this core as I'm moving. If you find that that's hard and you're trying to hold but you can't maintain that hold, it's time to rest. Now my feet are down and I'm done with the party and I can now let my core relax because it's last to leave. Okay, these are they're a whole progression of exercises that we can do, and that's kind of a fun way of progressing for people in all those different activities that I just mentioned. We can do these also in a sitting position, which sometimes works well when you're in your daily life. So if you engaged here and you got that feeling of solid and engagement of a bracing system here, engaging, and then we did a slow march. The knees don't go any higher than the hips. They're just going up a little bit. People might not even know you're doing this under your desk or you're at your computer or something like that. Okay? Feet go down. I'm at rest now, and now I can let off on the core. So these are just some starter exercises of the core. A lot more to learn here at Complete Physical Therapy. Thanks for joining.